All right, guys, I had somebody send me a question about how to reduce, oh, Sawyer wants to say hi. Hi. I had somebody send me a question on how to reduce the risk of capsular contracture. So let's talk about it. Capsular contracture happens when that capsule of scar tissue around a breast implant gets thicker than normal, which can make the breast implant feel hard. It can even be painful, and it often feels tight. Once you get to the more severe grade 3 and grade 4 capsular contracture, then grade 4, like, it distorts the implant, so it's visibly different than the other side. We think capsular contracture is caused by more inflammation than normal, and that can often be stimulated if you get bleeding around the implant and you have a hematoma. That can cause capsular contracture down the road. Really? If you have an infection, even one in a different body area, like I've seen people get capsular contracture in the breast after a soft tissue infection in the abdomen. So the implant, we think, can get seeded with just a little bit of bacteria that causes some inflammation, or the hematoma causes the inflammation, and then you get that robust scar tissue formation, which can make it firm. So there are a couple things we do to treat it. First line is spooky capsular contracture. So first line treatment is Singulair and vitamin E, which helps decrease inflammation. I have seen this reverse capsular contracture to a small degree. It does often kind of stop the process. So if you can stop the process where it just feels a little firmer but still looks okay, that's a win. Once the breast is distorted, or if at any point it's painful, then the treatment is surgical. And that involves releasing the capsule. Often will remove any of the thickened scar tissue. And then ideally moving the implant, if it's above the muscle, moving it under the muscle. You can do the reverse just to get it to a fresh pocket, but the capsular contracture rate is higher above the muscle. So generally I'll keep the implant under the muscle. If it's above, then I'll definitely move it under.
Mama,
You helping? The other thing we do is soak the pocket with antibiotic solution in betadine, or phase 1.
Mama.
Oh. And this is like more than the rinse out for primary breast augmentation surgery. This is like a good 5-minute soak. We also replace the breast implant, because if there's a little bit of bacteria seeding the outside of the implant, there's no guarantee that you could remove it. And if you put that same implant in, it could cause the same problem. So move the implant under the muscle if it's not already there. Remove or release any thickened part of the capsule. Soak the pocket with antibiotic irrigation, and then new implant. That's the treatment. It does have a higher risk of recurrence if you've already had it one time. And then the risk for saline versus silicone implants is the same. They both have a smooth silicone shell, same risk. Textured implants have a lower risk, but because of the increased risk of anaplastic large cell lymphoma, we don't use textured anymore. Okay, say bye.
No.
Okay, that's okay.